My client is a 51-year-old physical therapist who came from New York for me to treat her and her husband at Hesch Institute in Aurora, Colorado. And she was involved in a motor vehicle accident in the 70s, right?
Yes.
Okay. And that's the only injury that you recall?
Yes.
Okay. Alrighty. And we treated her low back, and we just filmed that. Her sacrum lacked forward bending mobility, and we restored that movement, and she felt a lot freer. And now we're focusing on the cervical spine and T1 and the first rib. And when I come to the spine, and I come up to what I believe to be T1, right here, that's the one that's prominent, there's no anterior spring mobility. It just feels very, very rigid, okay? When I spring the one above, I go a little bit deeper, so I believe I'm on C7. That moves freely, and then I come to T1 that doesn't move, and then I come below that to T2, and T2 has good mobility. The other thing I find is when I come and spring the first rib, it's very tight. I cannot get any movement of the first rib. And the first rib is like a short C, and it has about a 30 to 45 degree angle, and it attaches underneath and behind the clavicle, okay? And then it attaches to the T1 vertebrae transverse process, and it even abuts the disc and the vertebral body. Okay? So what I like to do to restore rib mobility, a lot of clinicians push it inferiorly and stretch the scalenes. But the first rib also rotates medially and laterally with upper body rotation. With rotation that involves T1, the first rib rotates. Okay? What I want to do, okay, is I want to distract the first rib laterally. Okay? The way that I do that is I push up on the tubercle of the rib to lift it off the transverse process, and there's a little bit of a lateral directional force. And then I pull on the shoulder blade on the acromion because that's where the clavicle attaches. So I'm pulling the clavicle laterally, and that's pulling the front of that first rib laterally. So the technique looks like this. I isolate that first rib and I push up, and again there's no give, okay? The first rib is located right under the thickest part of your upper trap. So if I pinch the trap and I can tell that I could feel my finger and thumb through that muscle, then I put my middle finger below that and I feel that rib. I feel that bony rib. So that's where I lift up, okay? And then I come along the clavicle and I find that bump of the shoulder, the acromion, and I push that laterally at about a 45 degree angle. And this is how the technique works. Okay? So I'm going to treat you on both sides. I'm going to restore motion in your first rib on both sides, and then I'll retest T1, and I believe that T1 will then have normal mobility. And I think that that will change how you feel. You did test neck extension in standing, and what did you say?
I said I wished, there was a spot where it just wouldn't go backwards, and I kind of wished it would move more.
Uh-huh.
You could just feel where it stopped.
Yeah. Very good. So we'll retest that after I restore mobility. Thank you. And then we'll come back and refilm the results.